Root canal. The phrase alone evokes fear and pain in the minds of many, and while root canals may be considered routine, some experts are beginning to claim that this dental procedure is not only unnecessary but harmful. Today, Dr. Alan Sprinkle shares the hidden dangers of root canals and why they may not always be the healthy choice. Next on Joni. Everyone has a story.
My greatest joy is in helping people and seeing them free from chronic pain.
Every life has something to share.
More than anything, I want my life to please God. I want him to look at me and say, that's my girl.
From tragedy to triumph.
Your memories will always be of the adventure, not the arrival. So savor the ride.
This is real talk about real topics that will change your life.
No matter what you're going through, you can always choose to love and choose to forgive.
So grab a seat and join the conversation. This is Joni Table Talk. Well, these days we're all concerned about our health, what to eat, what not to eat, how often to exercise. Did you know that your teeth and gums can affect your health too? Today we'll find out how and give you tips to keep your pearly whites and your body in top shape. Joining me around the table is my dear friend Tanya Taylor.
Hello.
How are you?
I'm great. I brushed my teeth really good before the program.
I'm glad you did. I'm glad you did. When you've got a dentist on, that's what you do for sure.
Absolutely.
Michelle Binion, how are you?
I'm doing great.
Good to have you.
Glad to be
and
here.
Cindy Murdoch.
Hi there.
Always a pleasure.
Thank you. It's
My
always
friend.
a
And you
pleasure to
always
be
love
here.
to learn.
Oh my goodness.
We've been learning a lot this week. We've been taping a lot of shows this week.
Yeah, I feel like I have been in medical school, college, and I'm learning so much.
I love that. And our guest today, my dear friend, Dr. Alan Sprinkle.
It's great to be
so
here.
good to have you.
Thank you.
Who's been taking care of me for a long time. Yes, he has. And
He sings your praises.
he's a great, great dentist. I tell you what, all you're going to be calling Dr. Sprinkle now. But anyway, from fad diets to organic foods, people everywhere are chasing a healthier version of themselves. But what many don't know is that a healthy smile can have a great impact on your overall well-being. But be cautious about what dental procedures you allow, because things like, root canals can actually be harmful. Take a look.
When you do a root canal, what you're doing is you're going in through the top of the tooth. Here's the decay. You can see here on this example, the nerve chamber's down here, and eventually that decay gets into the nerve chamber and causes the nerve to die. Here's another example of it, and it creates an abscess. Now your tooth is hollow, and the center of your tooth is a chamber, the nerve chamber, and it has blood vessels, nerves, and lymphatics in it. And when you do a root canal, you go in through the top of the tooth, you clean all this out, you sterilize it, you flush it out with different agents to try and sterilize this canal. Then you seal off the canal with a gummy material called gutta-percha. And that seals the tooth off, and then on some of these, like this tooth up here, you'd want to put a post in it and maybe a cord. A lot of times that core is made out of mercury amalgam. But then you can put a crown on the tooth. My problem with root canals is the fact that I was told in dental school that 90% of all teeth have accessory canals. And that's a canal that comes off the side of this main canal. And that can get bacteria in it. And I've been doing this for almost 40 years now, and I've seen maybe 5 accessory canals that were ever filled on a root canal. Now, there are lots of people walking around that are healthy and don't have any issues that they're aware of with their root canal teeth. But I'm afraid that some of these people, if their immune systems get compromised or they have some type of traumatic event in their life and their immune system gets knocked down, that there's the potential for a root canal to go bad.
Well, many people dread root canals. They are painful, take a long time, and can be expensive. But there are other reasons to avoid them, and that's what we're talking about today. You and I have talked about the subject many times, and you have a very strong opinion about root canals, and share with us what that opinion is and why you feel that way.
Well, to begin with, in my early part of my career, I did root canals, and I did a lot of them. And like I said in the intro, we were taught that you could seal this tooth off from the inside, sterilize it before you seal it, and that would take care of it. The problem that I find with root canals, like I said on the intro, is the fact that the core structure of your tooth is made out of a material called dentin, and it's extremely porous. If you took the smallest tooth in your head, which is one of these lower front teeth, it has these tiny little canals in them called dentinal tubules. And if you were to take all those tubules out of that one little tooth and link them together, it'd be about 3 miles long. So this is an extremely porous material, even though it's very solid and one of the hardest materials in your body. The problem I have with it philosophically is that we claimed when we do a root canal that we can sterilize this tooth. We may sterilize that central canal, but you're not going to get whatever sterilization agent you have into all those little canals, those dentinal tubules, and you're not going to get them into the accessory canals very often. And if you have a serious infection in a tooth, there's bacteria more than likely have gotten into those dentinal tubules. So when you seal the tooth off, okay, theoretically, those bacteria may die. Well, they're aerobic bacteria, meaning they require oxygen to function. Some of them will die, but some of them will mutate and become anaerobic bacteria, bacteria that do not require oxygen. And the problem with anaerobic bacteria is they produce incredibly bad toxins. Botulism is one of those toxins that comes from an anaerobic bacteria. So these toxins can build up. And again, if your immune system is strong, you may be able to tolerate this. But Dr. Boyd Haley is a professor of chemistry at the University of Kentucky. And he developed a test several years ago on testing toxicity of different agents to the body. And what he tested these with were enzymes that your body needs to produce ATP. ATP is the main enzyme that creates energy in your cells. Well, for a number of years, he had Dr. Hal Huggins had been sending him extracted root canal teeth because he had read about this affinity labeling technique that Dr. in Kentucky had, Dr. Haley. Dr. Haley, nothing wrong with these teeth. He wouldn't do it. Finally, to get Dr. Huggins off his back, he gave some of these extracted teeth to a graduate assistant, said, go run the test on these so I can get this guy off my back. Guy comes back in a couple of days and said, Dr. Haley, these are the 2 most toxic materials we've ever tested in this laboratory. Wow. And what they do when they test these, they take the extracted teeth, they soak them in sterile water, in 3 different baths. They soak them in one and put in another one, clean one in, and finally in the third one they soak it there. Then they take some of that water that tooth's been sitting in and then put that in this medium to test them against these enzymes. And very often it will wipe out all these enzymes. So it has the potential to really adversely affect your whole immune system. And the enzymes are what create this energy that allows our cells to function. So you become compromised. I just think philosophically there is a real problem in the science behind this. I mean, like I said in the intro, there are people walking around that are totally healthy with these, and I give my patients that option. If they have a tooth that I believe is in danger of abscessing, they can see an endodontist. That's someone who specializes and does root canals every day, all day long. Or they have the option of getting the tooth taken out, or they can leave it alone and take their chances. But my job, is, I feel, as a dentist, is to educate them as best I can, let them know there are conflicting views, but if you're going to have the root canal, have it by someone that does it every day, all day long, that has the greatest expertise.
But you won't do root canals.
I won't do root canals.
Because you don't believe root canal are healthy for anyone.
I don't do them, but because I don't do them every day. But again, and I tell my patient, if you're healthy, you don't have any kind of chronic illness, you can roll the dice and you can have the root canal, and it may never bother you.
Yeah.
But I see a lot of chronically ill patients in my practice that are referred to me by physicians, and so those people, I would definitely advise them to think long and hard before they had a root canal, because you're putting more burden, I think, potentially on your immune system that could come back.
Let me just put it this way. Would you ever have a root canal?
No.
Okay, that answers your question right there. It's kind of like you ask a cancer doctor, would he ever do chemotherapy, the ones that do it, and most of them say,
Nope.
No.
Thank you. So this is the thing. I'll tell you the way Dr. Sprinkle explained it to me. It's really simple. He said, your tooth is a living organ. So when you have a root canal, you basically like you said, remove all of that living material,
Right.
and your tooth is really becomes a dead tooth. Is that correct?
Right.
And so what do things that are not living, that are sitting in our body do? They attract bacteria because they're no longer living. They're dead. So that's really what a root canal. A root canal tooth is not a living, breathing tooth any longer. Is that correct?
Right. It can function
Yeah.
and chew food,
Yeah.
but it really is not a living structure anymore. And those dental tubules were there for a reason, for circulation of fluids in and out of that tooth to help maintain the health of that tooth. And once that has been sealed off, you reduce that flow of tissue or flow of fluids, and so that the nutrition and nourishment, the moisture to that tooth becomes negligible at that point.
Now maybe we can talk about in just a minute some of the alternatives. Some of you are saying, well, I have root canals and I've been having some problems and I wonder if it could be related, et cetera, et cetera. We will talk about that, but give us an example of someone who came in who had some medical issues that were directly related to root canals, and you know it because when they had the root canal removed, their physical problems were solved.
About 13 years ago, I had a young woman. Her husband brought her to see me because she had had chronic rectal bleeding for 15 years.
She'd seen all the doctors?
She'd been to numerous doctors over at Southwestern Medical School. She'd been to Scott and White. She'd been to numerous places, an internist, and trying to find out what was wrong with her, because every time she had a bowel movement, it was extremely painful and bloody. And so they come to me because her husband had read an article about your teeth can affect different parts of your body. And I told him when I saw him, so I'm at the other end of the tube. I really don't work down there, but you know, your teeth definitely can have an issue and create these problems because each tooth is on a different acupuncture meridian to different parts of your body. And I've seen this happen time and time again. So anyway, we took a panoramic x-ray, the large film that goes around your face, and she had one root canal in her mouth. There was an upper right front tooth. On the x-ray was just a small shadow above the tip or the apex of the tooth that made it look a little suspicious, but it wasn't anything that you could hang your diagnosis on that this is bad. The patient had no symptoms from the tooth whatsoever. You could tap on the tooth. She had a perfect porcelain crown on it that matched her central of the other tooth, and you know, you could tap on it. She had no pain with it whatsoever. But when there's another test that we do called kinesiology, which you're basically testing the energy through that acupuncture meridian, and when we tested that, the tooth tested really weak. Well, I told her, I said, this tooth is on the same acupuncture meridian as your rectum and anus, but you know, you need to get a second opinion, but you need to get a second opinion from someone who would even entertain this wild, crazy thought. And so I sent her to a naturopath who does what's called electroacupuncture according to Vol. This is a technique where you're measuring the energy flows off the acupuncture meridians through a computer. And I said, don't tell him what I found, just go in and tell him what your symptoms are and see what he can come up with. He found out that this tooth was an issue, and she decided to have the tooth out. We took the tooth out. When we took it out, there was an abscess on the back side of the tooth, just a ribbon-shaped abscess. Here's your tooth, and it's just as thin. It almost looked like the fin of a fish that was just filled with jelly. We took that out. We cleaned out the socket real well, closed it up, sutured it up for healing. The rectal bleeding stopped that night and never came back. And this patient's referred well over 100 patients to me, and she's just become a dear friend over the years. But I mean, that sounds far-fetched. It's anecdotal. The scientists will say, well, that's anecdotal. That doesn't prove anything. I don't care what it is. It could be a placebo effect. Who cares? The patient's better and her problem got better, and we were able to help her. And but I was very nervous about taking that tooth out. She wanted it out, and I said, I can't guarantee this is going to help you. And but we did.
Especially with it being one in the front.
Yeah. And so this not only, she was 27 years old. And so, how many 27-year-olds are going to come in and say, take my front tooth out? And so it almost caused me to have rectal bleeding to take the tooth out.
Well, and if she had suffered for that long, too.
Yeah.
When that stopped for her, that had to be incredible. What were you going to say, Tanya?
If you've had a root canal done, and say you've had it for like 10 years, and you've never had any physical problems, is it safe to say then that root canal did okay and you're not going to have problems?
I would hope so. I mean, I can't say for sure. I mean, if your immune system is strong, hopefully any problems that root canal might potentially have, your body's able to handle it. And you know, you may have gotten a great job done on the root canal where it's totally filled as well as it can be filled. And I would pray that you never have a problem with it. But and at one point in my practice, I felt like every root canal had to come out once I learned all this. But then I realized that, you know, there's some people that are able to tolerate these. And so, again, it's like anything in life, it's moderation and try and be as intelligent as you can about it. And if you have a person who has chronic issues and are fighting, you know, long-term chronic issues, they need to be aware of this and make their own decision.
Well, we have to take a short break. We'll be back with more from Dr. Sprinkle when Table Talk returns. Well, today we're talking about root canals, their dangers and their alternatives. So I know many of you are sitting there and you're saying, wait, Joni, I have many root canals in my mouth. We don't want to scare you by any means. And Dr. Sprinkle is a dentist. Can I call you a biological dentist? Is that a correct title?
Well, I mean, that's, I've been called an alternative dentist, a homeopathic dentist. It's just a title. It's just, my philosophy is different than the average dentist.
And what is that? What's different about it?
Well, we don't
Other
use...
than I love to go to him, and he's really a great dentist, and he looks at the whole being to take care of and wants to make sure to do the best for your mouth, so.
We don't use any mercury fillings, so we don't use, you don't have any, won't get a silver filling in my office, or more rightly termed an amalgam or a mercury filling. We don't do that. We don't use fluoride in my office, and we don't do root canals. And we look at the patient as one whole unit. I'm just not a tooth carpenter or a dentist in the fact that all I work on is mouth. All I do is work on the mouth, but I respect the fact that what I do can have tremendous influence, for good or bad, on that patient's well-being and health. And like I said earlier, I have a large part of my practice are people that are ill that are referred to me from their physicians because of health issues, and they come in
or
for us.
because of, and you won't say it, but I will, bad dentistry. I mean, you go and fix a lot of stuff that's been messed up. I know you don't want me to say that, but it's true.
But you know, we try to see the person beyond the teeth.
Thank God.
Okay, there's a human being there,
yes.
and I think in, you know, the knowledge that we have today is so much more expansive than it's been, obviously, with computers and things like that. And that's why everybody's so specialized. But we've become so specialized that we forgot we're dealing with a human here. There's a whole person here. And even though I just put one little mercury filling in that person, and we've saved the tooth and we got rid of the cavity, that mercury filling may have a long-term detrimental effect on that person. Okay, or the root canal. The root canal looks good or whatever. You know, that patient may later on become extremely ill. That can affect that root canal potentially, or they can be in an accident. They can have tremendous emotional, spiritual stress, and their immune system craters. We all are familiar with that.
Right.
And so, you know, the only thing that I try to, because I'm not a hero, I'm not a physician, I'm just a dentist. But again, my philosophy is based on the premise that we're incredibly wonderfully made.
Yes.
And that anything that we can do to help expand our patients' knowledge, to be careful about their health, improve their diet, you know, tell them to exercise, get plenty of sleep, all those things, brush, floss, yada, 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 yada. All those things any dentist is going to do. But again, the thing that we stress is the fact that we're not going to put mercury in your mouth. Okay? We're not going to put fluoride in your mouth, because I think fluoride is another whole issue we can talk about later on.
You're not going to do root
And I'm not
canals.
going to do a root canal, but I give that patient that choice. It's
Right.
their choice. And I tell them the pros and cons of the root canal and the pros and cons of having the root canal
Right.
taken
You let
out.
them make that choice. Now, on another show, we are going to talk all about mercury, so you want to be sure and see that as well. But, Cindy, you and I were wondering, if we go to the dentist, our dentist, and we say, and they say to us, you need a root canal, what do we say to our dentist, for those who, you know, live in other states and around the world, and the dentist looks at you like you are from Mars, and you're crazy? What do you mean? There's nothing wrong with this. How do you handle that?
Well, yeah, I don't know. I really, to be perfectly honest with you, I don't know. I mean,
Well, can I ask this then? If in that situation, if the dentist says this is what you need, with knowledge and understanding of what we face with a root canal, then what can our options be that we make a decision about our own health? You know, what are some of the options other than a root canal?
Well, if you don't have the root canal, then your other choice is to have the tooth removed, okay? Or you leave it alone. Leaving it alone is not a really very good choice.
Right.
Taking the tooth out, that can create issues too, because you may have a dry socket, and that's where the extraction site doesn't heal, and that can create
Or
problems.
you may have space where your teeth are going to move.
Your teeth can shift, and so if you take the tooth out, you want to have the tooth replaced. The sooner, the better, once that bone and everything is healed properly. So do you replace it with a fixed bridge, whereas say you were missing this tooth right in here, and this was a gap. So a fixed bridge, you would put a crown on this tooth, a crown on this tooth, and those two crowns are connected by a fake tooth or a pontic, and this is all then seated down and cemented onto the tooth.
And you don't take that bridge out.
And you don't take it out. It's fixed. It's not
Okay.
permanent, but
Yeah.
it's fixed. You can have a partial, which you've seen patients that have teeth that come in and out of their mouth, okay, that replaces just one tooth, okay? That has the benefit of the fact that you're not having to grind down a tooth on either side. The negative of it is it rides up and down. It can be a food trap. You really have to take good care of it, keep it clean, okay?
Right.
Then the implants. The implants is all the go today, all right? And they have, I believe, some drawbacks to them that patients need to be aware of. Again, it all reverts back to how well is your health, what's your immune system like.
So there's titanium?
There's titanium, and now we have a ceramic implant.
Which you feel better about, maybe,
I like it
possibly.
better just because you're not sticking a piece of metal in somebody's head. To me, basically, you're sticking a radio antenna in somebody's head almost, okay? And these things can have potentials to detrimentally have an effect on you. But anything that you do to the body can have negative effects, and so you just have to be careful. You have to try and educate yourself as best you can. The ceramic implants, they've been used in Europe now for a number of years. They've just received FDA approval here in the last several years. They show really good promise, plus the fact I don't believe that they have the potential to have the negative electromagnetic potential that the titanium implants have. So those are your choices, really.
Okay. Those are all of the choices, and there are choices. So stay with us. We reveal more on root canals with Dr. Sprinkle when we come back. Well, we've been talking about root canals today, and many of you watching have really been interested in knowing more about their dangers and what our alternate options are. So, Dr. Sprinkle, do you have one more root canal story for us?
Well, going back to the fact that your teeth are associated with acupuncture meridians throughout your body, and your molars affect your digestive system, they can affect your heart. But the lower left first molar is related to the pancreas in Chinese medicine. And I had a patient, an elderly gentleman that was diabetic, that had been on insulin for many, many years, and he had a root canal on a lower left first molar that had become terribly abscessed and had a large infection around it. And we really didn't have any choice at that time. Retreating the tooth was out of the question. So we took the tooth out, cleaned out the extraction site really well, flushed it out with antibiotics, and closed it up. And within about 4 or 5 days, this gentleman started having fainting episodes, they initially thought, but he was passing out. He was going into insulin shock. And what we realized was that his insulin requirements were much less now once this tooth, the burden of this tooth, had been lifted from his body. And so again, just another illustration of how your teeth can affect your whole body. And for those patients or people that are watching the show that are interested in learning more about this, or if they have questions about root canals or anything that we've discussed, there are several organizations. The International Academy of Oral Medicine and Toxicology is a great organization. You can Google that. The International Academy of Biological Medicine and Dentistry, the Holistic Dental Society. These are all organizations that have this philosophy. They're not recognized by the ADA, but You know,
And the
that-
ADA stands for the American Dental Association.
But these organizations, you can Google them. You can find hopefully a member that's in your area that you'd like to discuss your issues with before you proceed.
Yeah,
And,
that's good. Well, thank you, Dr. Sprinkle, for being
thanks
here.
for
Thank you
having
for
me.
sharing. I've been wanting you to come for so long. That's all the time we have. Remember, take care of your smile, and it will take care of you. Thanks for watching. Thank you, ladies. We'll see you next time. Bye-bye for today.
This has been a Daystar Television production.